Dr. Shoroye and to the Pediatric Department of the American Wellness Center in Dubai Healthcare City. I am delighted to bring some close to 30 years experience in pediatrics with special interest in pediatric allergies, asthma, and atopic conditions. We are basically an office-based practice seeing children, general pediatrics mostly, well child, immunizations, and the sick children. Admitting privileges within GCC here is to Clemency Hospital in the GCC 2 and hopefully to Mediclinic. And lastly also is the American Hospital Dubai for admitting privileges. Okay. Now I am also honored to be in a culturally competent society in terms of sensitivity to the cultures of this region, which I've been privileged to have been part of almost in the last close to 7 years in this region. And COVID has been an issue, particularly this year. And I had a good opportunity to have witnessed it from the beginning, early this year, around February 2020 at the American Hospital. We saw quite a few coming to the emergency room that needed admission. Fortunately, from this anecdotal experience, we actually were not having too much. We had a few patients coming, but not very ill. And we had close to almost no mortality. That is my anecdotal experience at the American Hospital in Dubai in the beginning of the COVID season. Later, the authorities did the lockdown. And I should mention also at this point that the government and the authorities of UAE should be commended for a very strong and bold initiative in terms of COVID control by locking down and of course the basic precautions of social distancing, people wearing masks, use of sanitizers, all those things. And the school were locked down. School were going online. And that was a very good thing until the lockdown was opened just a few months ago when Dubai was back fully into business. So, but I will say a little word of caution. I don't have too much data in the region, but global data that is evidence-based is showing some rise in morbidity and mortality of pediatric COVID. So it's a word of caution. So as the schools open back to school, most of them physical, some are scheduled online. The caution is to think that pediatric COVID is not a serious issue. We should just be on the alert that yes, we can see some morbidity and some mortality in a few occasions. And the specific disease is called the multisystem inflammatory syndrome for childhood COVID, for COVID-19. We most times don't even come with pulmonary lesions or pulmonary disease that we see in adults. They come with systemic issues, gastrointestinal, neurological, and some other systemic manifestations. So that is all I would say at this point. Then the other word I would just mention also, which is important, I know that unlike in North America, is not a mandatory requirement for school in the fall. This is now getting to September through October about flu vaccine. Flu vaccine should be encouraged. People are getting the region, people ask that we should encourage more for pediatric age group. Because when you get flu on top of it and COVID comes into play, it might not be a very, very pleasant experience. So that's what I would say. But in general, in terms of prevention, it's still the same thing for school children. Observe your children for fever, they scan everywhere we go. And the schools should be vigilant also. Social distancing, avoid too much gatherings around school children. And of course, the other basic things about wearing masks and using sanitizers from time to time. I think that's all I have for you from the American Wellness Center. Welcome aboard, everyone. Thank you.